This is especially for the matriculants or the people that are leaving high school this year or next year. Something to think about outside of nursing, but within the medical sphere. Hi guys, welcome back to another episode of Nursing with Ingrid. Thank you very much for all the love and the support that I get. I know I say this all the time, but I absolutely appreciate everything that you guys are doing, and by watching my videos and commenting at the very same time. It is very fulfilling, it is very rewarding, and it is absolutely humbling. I would like us to keep growing this family, and please don't forget to like, share and subscribe if you haven't subscribed as yet. But please make sure that you like the videos and you give me feedback, positive feedback, or if there's some things that you need me to change, please feel free to put it down below in the comment section, and I will address those issues as we go along. Firstly, I'd like us to go back to the previous videos that I have recorded. The intention of this channel as a whole is to improve nursing care, improve health care within our environments and institutions, and it is really not to make you scared in any which way. I believe in making sure that when you do make a decision, or when you are deciding on your career going forward or advancing your career, that you have all the skills and the knowledge, and as well as all the ups and downs that go with it, so that you can make a very informed decision as to which way you want to take your career. So I've realized that I've been scaring some of you guys. The intent is not to scare you, but to tell you the reality that is out there. In our times, we just saw nurses as these amazing angels, and we didn't know what was on the other side. However, there's a lot of dynamics that happen in the background within the nursing fraternity, within the medical fraternity as well. And for me, I just want you guys to know exactly what goes on, so when you do get in and you do encounter these instances, you know that it's something that you are aware of, and maybe you'll be able to handle it a little bit better than not having known, going in blind. And the whole point is also for me to remain sincere and responsible, as well as accountable for the content that I put out. Like I've said in my previous videos, I love nursing. I've always loved nursing, and I will always love nursing. And that is why I decide to give you these topics that we can discuss, that you can be aware of. At the end of the day, it is the most beautiful and the most fulfilling thing that you can ever do with your life, because it's not everybody that is able to take care of ill patients. It's not everybody that is able to help grieving family. It's not everybody that is able to help sick children. So with nursing, it is an absolutely beautiful profession. It is a calling. It remains with you for the rest of your life, even after you've retired, or even after you've moved away from actively nursing. It always stays with you, and it will always stay with you, because that is the nature of nurses in general. Okay, and what I want to discuss today, as you see by the title of the video, is phlebotomy. Now, what is phlebotomy? Phlebotomy is the art or the science of drawing blood samples using a needle, putting it into a collection bag, and sending it off to the laboratory for analysis. Some people call it drawing blood. Other people call it venipuncture, but it's all one and the same thing. And the essence of it is to draw blood, or to take a blood sample for analysis, for diagnosis purposes, and for checking your patient's well-being as well. At this point, you must probably say, well, Ingrid, what has phlebotomy got to do with nursing? Phlebotomy can be done by nurses. Those are your nurses that are in the blood banks. Those are your nurses that are in the labs. As well as you can do phlebotomy as an independent course which is a 2-year program, depending on where you're going to do it. And with it being a 2-year program, there's a lot of learnerships that are available throughout the country and with the different laboratory spheres or spaces, right? How do you get in? You need a matric, first and foremostly, or a grade 12. You need a grade 12 qualification that has mathematics, pure maths, or maths lit. You need to have biology. It is a must because the whole point of phlebotomy or being a phlebotomist means that you need to understand the anatomy of your circulatory system. Okay, so to better grasp that concept, you need biology and you need maths. Sometimes you will have to travel where there's some patients that can't get to the laboratory, but they need their tests to be done. So you will do a house visit and collect the blood and do all the things that you need to do. So you need to have at least a driver's license at the bare minimum. A driver's license because most of the laboratories have their own vehicles, their company vehicles that you can use. So you need to have a driver's license as well as your matric certificate. Once you've gotten your grade 12 results, what you can do is you can go and apply online in any one of the various private laboratory services, which is your AMPATH. They have a learnership program that runs every year or every 2 years. You have Lancet Laboratories, which also has a learnership program. You have Global Laboratories, which also has a learnership program, and then you have PathCare. Now these are all different areas that you can apply or different institutions that you can apply through, and those are all available online. I will leave the links below in the description box so that you can go and have a look at it. If it's something that you could possibly entertain the idea of, or you would like to pursue it and understand it a little bit more, I'll leave the links down below for you. So what is the function of a phlebotomist? A phlebotomist is responsible for getting good quality samples of blood or good quality sample of urine or any other body fluids or body tissue. But when it comes to the tissue is normally harvested or taken or sampled by the doctors or the nurses within the ward environment, and then you are then now responsible for transporting that sample to the laboratory for analysis. As a phlebotomist, you will also be expected to give pre-test counseling for HIV tests. However, you need to realize that you will only be doing the pre-test counseling because at the end of the day, it's a prescription or it's an order that has been given by a doctor. So you have got nothing to do with the results when they come out. The only thing that you are basically responsible for is telling the patient that this is what we're going to do, this is the consent form that needs to be signed. You need to acknowledge that this is the test you've agreed to do according to what the doctor has written on the form, right? So you don't do the post-test counseling. That is done by the doctor in the ward or in his surgery or wherever the doctor is based. That is where that part of the results happen. And this is predominantly throughout the phlebotomy environment or phlebotomist's environment and the laboratory environment. You do not have the capacity to interpret results, to give patients results without getting permission from the doctor. There are some results that are very sensitive that need to be handled with the doctor, and you play no role in that. Once that the report comes out of the results, they get sent to the doctor, and then the doctor makes the appropriate arrangements and makes the appointment for the patient to come back to them for counseling or to clarify what the results are. The other thing that phlebotomists do is they are also in the blood bank. So at this point, if you get into the blood bank, you will be drawing blood for blood transfusion. You will be part of the SANBIS community, which is the South African National Blood Services, and you'll be collecting bloods and going from place to place, collecting bloods and doing that the blood drive and the blood campaigns along the way. So that is also a very interesting and a very fulfilling way of giving back to humanity by helping somebody draw blood that might be used for someone else. So in all, being a phlebotomist doesn't exclude you from seeing patients. It doesn't remove you from interacting with patients. However, you interact with them on a different level as you would if you were a nurse or if you were a doctor. As a phlebotomist, you also need to be a very good team player. You also need to be good with time management. You need to be absolutely eloquent in your communication, because sometimes by the time the patient comes for their blood tests, there's a whole lot of things that have happened in the background within the patient. So you need to be able to counsel the patient, to calm the patient, to give them that extra support that they need. Some patients are very fearful of seeing blood. They are very fearful of having their bloods taken because they don't know why they need to take the bloods, or whatever the case may be. So you need to be very good at communicating exactly what the process is going to be, what the patient needs to expect throughout the process of you collecting blood samples from them. As a phlebotomist, you also need to be very ethical, and you need to maintain the highest level of professionalism. And by saying that, it means that you are bound by the POPI Act also to protect patient information, to protect people's dignity, and to protect their results as well. Okay? As a phlebotomist, you'll also be taught how to take blood pressure, temperature, pulse, as well as you will need to know how to handle a patient that will react adversely to you taking the bloods, because some patients do collapse, some patients do get very anxious, they get very afraid. You know, the anxiety level raises much higher. So you will be trained in those areas on how to handle a patient if they have an adverse reaction to you taking the bloods, or if they react completely different to what you expect. So you also need to be compassionate at that point. You need to be empathetic, and you need to be very supportive of the patient, or at this point, it's a client. Now we're going to move on to, as a phlebotomist, how are you recognized? Okay, how are you recognized within the medical or within the legal environment of healthcare? As a phlebotomist, you are governed by the HPCSA, as opposed to us as nurses that are governed by the South African Nursing Council, which is SANC. So you will fall under the Health Professional Council of South Africa. That's where you will be registered, and that's where you'll be able to get your ability to practice, or your license to practice as well. Now, when it comes to the phlebotomy training or the course, at the end of it, yes, it's a valid course, it's a valid certificate, it's a valid qualifications, because it has been approved by SAQA. SAQA stands for South African Qualifications Authority, and they have got this graded scale, and it's the certificate that you receive is recognized as a higher certificate or higher learning certificate, which means that it's authorized, it's approved, it's recognized within South Africa throughout all the institutions that you may want to work with. Phlebotomists, after qualifying 1 to 4 years, their basic salary is 155,000 per annum, which roughly is around about 11,000 rands a month. So that is what you're looking at. And then after the 4 years, then the pay scale raises, and so forth and so forth and so forth, as usual. It's purely based on your experience in the clinical in the clinical sphere outside of you doing the training. So that is phlebotomy in a nutshell. That is what being a phlebotomist is all about. And for me, it was just something that I needed to throw out there and put out there as an option. You will find me on Facebook, on Instagram, on LinkedIn, so that we can have a chat and we'll take it further. Otherwise, from me, I'd like to say thank you very much for your time. Thank you very much for your energy and your graciousness to watch this video, and I truly appreciate it. If you like this video at this point, please give it a massive thumbs up, and I will see you in my next video. And with that, take care, God bless, goodbye.